Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Again, first-time listener.
Well, as far as the knee goes, it's the capsule of the knee that's injured, not the knee itself. In other words, these are normal knees.
Right.
With the pain on the outside. The ligament structure is where the pain is. Now, you can treat that. And also you figure out why it's injured in the first place. Because just doing cheerleader is not going to hurt those things.
Right.
Shoulders are the same. It's a capsule around the shoulder, not the shoulder itself, where the pain is. And if you want to check it out, just go ahead to the library and look up the nerves to the shoulder or knee, and you'll see that there is no nerve fibers that tell you pain fibers inside the joint. There is none. It's all in the outside.
Okay, great. So if anyone wants to call Dr. Pannozzo after the show, you can call him at 561-381-5800. He will answer the call, ask him any question you want, and maybe set up an appointment to get better. That's 561-381-5800.
You wonder who's treating these shoulders and knees now.
I don't know. I don't want to mention that word. So I'm not going
to. What I've proposed to this writer of that note is a science. This is a science. You improve right away. There's no treatments. And we figure out why it hurts, where it hurts, and then what to do for it.
And no one leaves that office, Doc.
And no one leaves that office with the pain.
Okay, let's go. We got someone from West Palm Beach. Good. Paul from West Palm Beach. I have been actively playing football in the West Palm Beach area for 3 years and was just told that I had a groin pull that would keep me out of the lineup 4 to 6 weeks. I heard about your show and went to the website and thought I saw that you worked on migraines and scoliosis. Wanted to know if groin pulls are in an area that you can work on. How long would I have before this thing is fixed, and how long will it take me to get back to football activity?
Well, there's only 5 places in the groin that hurt you, so we fix it right now. In 2 minutes, you're fixed.
I'm not gonna say anything about groin pain. I was told not to say anything, so I'm not. But I had it done. I was back lifting weights.
He hurt himself pulling luggage out of a car.
Well, you remember
that was a groin pain.
Yeah.
And there were 2 areas. We took care of one day, one the next day, and that was it. And that was over a year ago.
Way over a year ago, because I went to look it up.
No treatments, no sideline, nothing.
No pain, no drugs, nothing.
You see, if you know what you're doing, you could do it.
Yeah, well, that's what
Russ?
Look, the bottom line is, if you...
I can't go to the moon, though.
Well, you might be.
I don't know how to do that.
Well, look... You might be hey, you're working on migraine headaches, and you discovered...
I know how to do migraine headaches.
And you discovered how to get rid of vertigo.
Do you know that vertigo and migraine headaches, I have not had anybody to come back and say I failed.
Well, let's see, 1, 2, 3.
Can you believe this?
I sent it 3 people.
Original research work. Go ahead.
We do this show for one reason, to give you some education, and we also do the show to let you know that you don't have to suffer anymore. I hear people that suffer from migraines and say, everything that they ever went for never worked. I mean,
and look at the medication they don't have to take.
Oh, God.
I mean, that's expensive stuff. And you come to my office one day, that pain's gone for migraine, a true migraine, and doesn't come back.
Not really good for business, is it?
It's good for business. Well, this is not like a retail business here.
I mean, how many people could honestly say that they took an aspirin or Excedrin PM for migraines and it never came back again?
They can't, and I'm working my way out of business every day.
Yeah.
That's what I do. work my way out of it. I don't want you people coming back.
No, he wants to go
Fix
to
you
lunch
one
with
day.
me at least 3 days a week, right, buddy?
No.
Okay, Lucy from Boca Raton writes, I've been a waitress for over 20 years. I've always had bad hips. Now that I'm older, the limp is worse and the pain grows tremendously worse. Your producer came in to have lunch and asked, would tell you my story so that perhaps you can help me. I had a car accident over 22 years ago and my hip was diagnosed as bad and have to be replaced. I never had surgery and continue with bad hip, working and moving. Now that I'm older, it hurts a lot. My knees hurt. What can I do? Can you still help me even though it's been many years I have this problem?
Yeah, it's you have to look at an alignment program. How is she? Leg length deficiencies, if they're lower back pain causing some of this. You don't know. You have to examine everything.
No, a lot of things we can't tell you on the air because he has to examine you. I mean, to see what it is. So,
Yeah, so these are all the possibilities, but we do treat it, and we treat the pain you're complaining about. The reason you came in, we'll take care of that one. Not all of them, but that one for sure.
We've had somebody that came in that was told she would have to get shots, medication, and a brace on her leg.
Ooh.
And I asked her to come in to see you, and you had to walk. Because I mentioned the word we, and nobody, throughout the United States knows who she is, but she's a very good person. She works at the station that we broadcast from, and you, after you saw her walk, you said, it's not your ankle. Now, how many people could do that in this industry? I mean, seriously, that they could walk and you could diagnose that it wasn't the ankle.
Well,
think about that. I mean, that's a credit to you after doing all these years.
Well, if you see 70-some-thousand people, I mean, you should be good at it.
Yeah, well,
or halfway decent.
I think you're great at it, but that's just me. Okay, Ty from Washington, D.C. writes, I have lower back pain and had it for a very long time from a skiing incident over 5 years ago. I've taken pills and seen chiropractors and pain doctors, all which give me pills and rubs, and nothing seems to make the pain go away permanently. I watched your show on the air and was amazed that you do what you say you can do. Since the lower back is a bit complicated, is there an area that you would go into to stop the pain in my lower legs and get me to be able to tie my shoelaces again? Can you help me?
Well, tying the shoelace is not a part of the lower back pain. That could be hip.
Okay.
So you have to know these things. But it's not complicated if you understand it. I mean, if you understand something, it's got to be simple to you.
Well, it's the only thing you've ever done your whole life.
And it worked out. It's unique. It's a unique approach we use. So when you go to some of the doctors, they don't understand it. Mm-hmm. They don't study it. You can't study it. There's no books written on it. There are books written on it, but that don't tell you anything. I've read them. They don't tell you anything.
What a lot of people.
So if you want to really get it treated, you have to know the source of the pain. And remember, it's a failed physiology. It's really a physics problem. Mm-hmm. It's not a medical problem. We treat it with medicine, but it's not a medical problem. It's a weight-bearing issue, see, backache. So you have to approach it differently. And then you have to know the anatomy and how you use the anatomy, the physiology.
Cause and effect.
Cause and effect, absolutely.
Where did the pain come from?
Where does it come from?
Am I doing good?
You're doing good.
We have another thing from Washington.
The only thing you learned on all this time.
I'm telling you, if Doc isn't in that day, Freddy, just call me up. I'll take care of it. Anything you want to talk about sports before I go on to another Washington call? This is 2 calls from Washington. Very nice.
We were talking about before the show about how the NFL ex-football players are actually hooked on drugs.
Oh, sure, the pain.
Painkillers and everything else. But it's become a problem. And what's happening, I mean, any drug use is a problem. But what's happening is there's a new movie coming out next month that the NFL took out a court order to stop.
Will Smith's movie.
Will Smith with concussions.
Yeah.
But this one's a whole lot deeper than concussions.
Yeah, I know.
You got Hollywood Haywood from the Dallas Cowboys.
Oh, I remember.
Drug addict.
Yeah, why them are?
What he said was in the day when you had a pain, they put pills in white bottles with your number and name and put it in your locker. So nobody knew who was giving you this stuff and tell you to get back on the field. And now they are addicts. They're hooked on all sorts of drugs.
Well, we knew this a long time ago. That's why we came on the radio. We're trying to get known for taking care of these people.
With no drugs.
We actually take care of them without drugs. But if you go to the NFL, you know they're all taking drugs. The orthopedic surgeons don't know anything about treatments. Who does treatment? They do surgery, and they're in charge of the medical. So how are they going to make up for the fact that they don't do musculoskeletal medicine? They're going to do drugs. You go to the VA up there, the pink house on the hill up there in West Palm Beach. You go there with a backache, what do you get? You get narcotics.
Yeah.
They don't treat anything. I see those people. That's why I know that.
You went to see chiropractors.
Well, then they push them off to the chiropractor.
Right.
And the PT. Just waste time. Then you lose your career, you lose your home, you lose your wife, you lose everything. It's not good.
Well, look at Evander Holyfield.
So now, if they take advantage of what I'm saying, I'm liable. I mean, you could criticize me on my own program. I mean, the lines are open. Did you give the number lately?
Yes, they did. I'll give it again. If anybody out there who's got a Dr. Pannozzo and hadn't been cured for the ailment they came in, or if you're a chiropractor who's listening, I know you're out there, or an orthopedic surgeon who's listening, I know you're out there too, please call up and give us your opinion. 800-889-0267. That's 800-889-0267. We do not do any screening. That call comes directly into me. I just put it on. Dr. Pannozzo will answer any question. And he's not going to yell. He's not going to scream. He's just going to tell you fact. I mean, if you're having pain or your chiropractor can't fix you, call up Dr. Pannozzo. Right now, call us on the air. So this is open to all chiropractors and
It's
all
open to
orthopedic
anybody.
surgeons.
Anybody who is repeatedly going to get medical
Yeah,
attention.
in my office, if you go there 2 days and don't get enough relief out of it, you're in the wrong place.
That's right.
I'll tell you right up front, you're in the wrong place. I missed it. Or we start over and try to find it. So sometimes you do that. But we don't treat you for a year, 6 months.
Oh, God,
Don't
no.
come in there if you're not getting better. Come in there with a new pain, and we'll treat that. But that's the deal I'm making with you. If you walk in there, we're going to take care of that pain. I don't know what else I could do.
Well, you're gonna limp in and leap out. In fact, everybody at this station was what have gone to Dr. Pannozzo, from board ops to Freddy to myself to Leah to Gary. I mean, anyone that hears them, they come in. They don't want pain anymore.
This week, I remember one this week.
Good.
I'm going to tell you about that.
I always like to hear that.
Guy's been disabled for 6 years with a low back pain and a leg pain. And had a cage put on his back.
Oh, God.
And he's a plumber. I said, how much money are you losing? Plumbers make a lot of money as far as I know.
Of course.
He said, I'm losing a lot. I said, well, you want to get back to work? He says, I can't. I have too much pain. I said, well, I guarantee you this pain is not going to last. So the leg pain was from a tendon, which everybody missed. I took care of that in one shot. Okay, so most of that disability was gone already. The low back pain, the cage was done right, but there was inflammation underneath it.
What's a cage?
Cage is, they put a rod like this long, about 3 inches long with screws to hold your bones together.
Oh, my God. Wow.
Their theory is that they can prevent your bones from moving, therefore you will not have any pain, which is absolute nonsense. That is not true. You have pain because of the inflammation around it. So that's what he had. I did 2 shots there. All that pain was gone.
Wow.
Now he's like in a fog. What happened to me? What happened to me? I don't have any more pain.
Well, when
I said to the wife, I said, you want him to go back to work? He's going back to work. Oh, if that's only possible, she said. Well, see, the negativity is so great.
You're right. Exactly.
You can't keep going to the same doctors who keep you disabled. I mean, believe me, I'm a consumer just like you. If that happened to me, I wouldn't go to that same guy twice.
But people keep doing the same thing over and over again. They don't know any, but it's easier to look at the negative than it is the positive.
Well, because I think they've been taught all these years, or said all these years, well...
This was at Port St. Lucie, see?
Really?
A lot of people from there.
Well, we have people that come from... didn't you have someone came down from California, right?
Yeah, well, the son brought her in.
Right. Yeah, what people... I guess, to be honest as I can, is that I couldn't talk about something or recommend something to a friend or a family member unless I went to you myself. And I think Freddy's the same way. I mean, Freddy went to you, and he was cured, and now his son is going to you also.
this lady from California, she had a migraine, and the son brought her in here.
Right.
So I took care of the migraine. I treated that. Then I talked to people for a couple of minutes afterwards, and I do my paperwork, and I said, "How you feel?" And she said, "Oh, it's my whole head cleared up." She said, "My nose, my breathing is better. My head just feels clear." And 2-3 minutes after the treatment, I mean, now then I saw her again a couple of days later for the last time, and finished up on all the problems we had there, and she was still just as nice and clear as can be. That is the best migraine treatment you can get, and I have no shame. I'm going to tell you, I developed it, and it is.
You
good,
should be,
and it's good.
You should be happy. I mean, the only
Everybody
people,
should be running in there getting it. I mean, I don't understand why they don't.
It goes back to what Freddy said. Freddy said the same thing that I keep saying is they can't believe.
Yeah.
That their doctor who told them that you gotta move your head around for vertigo, that could be cured.
Vertigo does not happen. People go to the big schools like University of Miami Medical School.
My
Get
alma
the
mater.
Neurologist there. Okay, neurologist says you have migraine, and take these pills, and that's it. That's the best. That is not the best. Remember, we're all doctors. We're all trained the same way.
You were trained the same way as a doctor,
Trained the same way as that guy.
right?
But I deviated because we went into treatment more rather than teaching more. See?
But that's important.
That's important. It's important the background you have. How many physics courses have you taken before you went to medical school?
Oh, they don't have to take physics when they go to medical school, right?
You do, but how
many?
interested are you in that?
Right.
How many chemistry classes? Everybody's different.
Mm-hmm.
So we all have MDs, but the training then after that is a little different. And it depends on your background, how you take that training. So we're not all the same.
Mm-hmm.
Insurance companies want you to believe that. That is not true.
No. Well, insurance company, that's a whole show in itself.
Don't get me started on that.
No, why'd you say
My blood
that?
pressure is going to go up.
No, I don't want that because you have to drive home. I don't want your blood pressure to go up. Please, take a deep breath.
You're sitting in the suicide seat.
Oh, yeah. I know that more than you think, Doc.
That's a good choice of words.
So if you ever get mad, okay.
We only do it in fun, people.
Yes. What we're trying to let people understand here, which is really, you don't have to live in pain. I say to everybody, come in, don't even put your name on the list, sit down, and just listen to the people. Just ask one of the people there. It doesn't matter, whoever it is. Say, how is he? And everyone thinks you're Moses. That came down because I don't know anybody.
We got to get a tape recorder in that waiting room because you can't believe what people say.
I can imagine.
It's just well, you were there with me. We went in when we first met you. I asked these people. They were eating lunch outside, waiting to see you. It was like crazy, and they all said the same thing. One guy said, "I came in with crutches. This now I'm walking normal." So I mean, this is real medicine. That here's something I always had to ask you. I'm not knocking any doctors, but how could a chiropractor, I'm just off the top of my head, fix a problem that someone has by adjusting the head or by adjusting the neck or by moving the arms when they don't know where that pain is? They can't see where that pain is.
Well, that's precisely the point.
Yeah.
They go to a trade school and they only learn certain things.
Right.
If you put a problem to them and say, what would you do with this diagnosis? They don't have it.
Okay.
They don't know how to do anything like that. And I've done that. I mean, it's not like everything I talk about I've already done. There's no supposition on my part. Mm-hmm. These are facts. And they just not trained that way. How'd they get a good reputation? I mean, they could do what they can do.
Right.
But if you have a real problem, they're not going to be able to do it because you need a source.
See, that's what people have to understand. You need to know the source of the pain, which you find. I mean, I've been there where you've actually shown the person, see right here? That's where the pain is. I'm going to get rid of it. And you show it's like with scoliosis. I mean, Freddy and I were blown away. I mean, to me, that's a most amazing thing what he could do with scoliosis. I mean, to me, that is better than anything I've seen. I know migraines are great, but to watch a child, go from looking down to almost straight, perfectly straight. That is, how the heck did you figure that thing out? I mean, I
don't know how I did it.
I mean, come on, let's talk about something that's revolutionary.
Well, basic thing is on scoliosis, you're not born with it, so you have to get it. I mean, I delivered 40 babies. Can you believe it?
Really?
Yeah.
Wow.
Everybody's born straight.
Amazing. Right.
And how do you get crooked then?
I don't know. Yeah.
Scoliosis. Well, it's got to be due to trauma, falls. So what happens is when you fall, your bone structure moves and gets stuck there. So if you're straight and you fall and you're this way, your bone structure, your vertebrae, what happens to the thing? It's curved. That's it. That's a scoliosis.
Wow.
No heredity, nothing else. That's all it is. No, you're not born with it. No birth defects at all. That's how you get it. And so what's holding the bone structure that way? Scar tissue.
Wow.
Scar tissue from what? Ligaments. Ligaments are very sensitive tissues. I mean, I could write a whole book on the qualities of a ligament. That's what holds you crooked like that. That's what's so painful. And you won't move because it hurts. So you solidify that way. Now, I come along and I say, well, you're curved here. It's got to be a scar tissue right there. Put a shot in it, comes right out. Now, we got to write to the hospitals, children's hospitals are doing that surgery. We got to tell them to stop doing it. They got to teach this stuff.
No, they won't, because it's $150,000 for surgery.
Don't tell me that.
I mean, I don't make the. I mean, I want people to understand. I look this stuff up.
But what I don't understand is how parents will force their kids into that surgery. And I can't understand it. I said, don't do it. Wait, just let us treat this a little bit, and you'll see the difference. I mean, right away, not months, right away.
That day.
And they don't. They still go and have that kid operated like that. I mean, I just don't get it.
So if you have a child or you know someone that has a child, and you go to Pannozzo.tv, that's PANNOZZO.tv, you can actually see people, and what Freddy has taken pictures of these people, how they're actually straightening up before your very eyes.
They straighten up before their very eyes in the office.
And we can't do this one, so I just want to be, he's not going to give you one shot and you're going to be straight with scoliosis. It takes time on that one. This is not a one-shot deal.
If you're young enough, you don't even need a shot.
Right.
But you want to put the steroid, and that's the class of drug we use.
Right.
Everybody uses the same. That's the only one that works. That class of drug, you have to put it in the right spot, and that's what I do.
That's the difference.
That's the difference.
Yeah.
I mean, you can't just go to anybody and get a shot.
No.
It's not going to help you.
No. The source of the pain.
That's actually 75% of the deal. Is that Gio walked in here and he said, "Why you hunched over?" And quickly he saw there's a problem in his lower spine. I'm his father. I see him. I don't see any of this stuff.
Well, Gio, you're going to be straight when we get back. Okay, no, it is amazing because people, I had to talk this person in, who I know for a long time, for almost 6 months, to tell her stop coming and see him, and she went for every treatment there is. I'm not even going to mention the name of the product, but she went to everybody from Miami, no guarantees, suffered until I brought her in, and he gave her a shot, and her vertigo went away. And now she's a salesperson, has to be in a car all the time, and she would get very nervous because she would start getting dizzy. For some reason, when two cars were one on one side, one on the other,
I think it was when she had to brake fast.
Yes.
She would, her head would bob, and she'd get vertigo like that.
And now it's, she
didn't have it. We only saw her one time.
Yeah.
I mean, gee, she should come back.
Well, she's nice looking.
She's nice looking.
Yeah, we like that. She could come back just to say hi to you. And then we had the young man who came in with a migraine, who did not have a migraine, and you not only fixed the migraine, but you fix his TMJ.
TMJ.
That's amazing. Why doctors charge $2,000 something to put that thing in your mouth, and that doesn't get rid of TMJ.
No, it's counterproductive.
Right.
It holds your mouth open, which makes you scar down on your TMJ. You don't want to use things like that.
Oh, I didn't know. Okay.
Yeah. So. Headache right here.
On the right. Freddie, can you see? You can see where? Yeah. Okay, good.
That's a TMJ headache right there.
Really, up here?
Right there.
Wow.
Right where my hand is. Back here is the migraine.
Wow.
That's it.
It's the area for the back where? In the upper spine?
My thumb and finger.
Right, and where
there.
is the area that you treat that with?
At the thumb area.
Oh, it's in that high? Oh, okay.
It's the base of the neck, base of the skull.
You said something before that. Did you ever notice all ex-NFL players are a little tilted down a little?
Sure.
So that's from scoliosis.
You bet.
Yeah, because whenever you see like a guard or a center, they're all kind of like leaning over a lot. And
Well, you know how much injuries they got on the spine from getting hit?
Oh,
the,
God, yeah.
The old saying that no pain, no gain was really stupid.
Mm-hmm.
In these guys, if you have a pain, it should be treated right now. Don't put these guys through this. This is why they're graduating out of the NFL and taking narcotics. They don't have any recourse. They have no treatments for this. But I do. You got to call me and you got to look at it.
So all you NFL players, we're going to start having a couple of very important NFL players on pretty soon that'll talk to you about the problems that they've had, and they'll even tell you their name. Am I right?
Well, the funny thing is that the ex-NFL player will show you 5-10 years in the NFL. What you look like, what your hands look like, your back, your legs. And a lot of these guys love to play golf. I know one in particular. Can't do it.
I think there must be a lot of peer pressure about getting treated for a pain.
Well, it's a club.
In the NFL, it's a club. And if you don't get out there with the pain, they go, oh, you big sissy. I'm sure this happens. But it's not true.
You don't want to talk bad about the NFL because that's where you made your livelihood.
No one's going to say anything bad about it. And you know what? Look, the bottom line is I thought the same way everyone else thought about you until I got to know you, and I've seen you actually turn away patients that said, I can't fix you. If you know you can't fix somebody, you don't give them a shot. There's no reason to. You tell them to go somewhere else because it's not the problem that they have. I mean, the NFL players, forget it. They're in this thing with trainers. I watched the guy that I was watching the Alabama game, and and all of a sudden the trainers come in and they're moving the knee, they're moving the leg, and they're putting a brace on him. And one thing you told me, the brace inhibits your movement, and it can't get better.
Causes more scar tissue.
Yeah, it's like gym guys that always wore the belt.
You can't have a knee injury. I mean, knees are not injured. It's the capsule around the knee that's injured. The capsule is ligaments.
Right.
That's what holds the bones together. That's what moves a little bit. If they move too much, you get a pain there. You can take care of that, and it's not that hard to do. I mean, it's you have to have the mindset to do it, though, not a surgery. So if you look at a knee and you say, "How can I operate that?" You're in the wrong place, people. Don't go there.
Well,
didn't you have a question about a shoulder and some ligament damage?
Football Atlanta.
Something that they wanted to operate on. Was there a question in there
about
this
that? Adam from Atlanta writes, I played football in the Atlanta area and wanted to ask, I sustained shoulder damage in a game that the doctors say I need surgery for my labrum. I don't know what a labrum is. My LABRUM is intact, but ligaments around the shoulder need repair. I have been told my season is over and that next year I should recover fully. My question is that if you fix my ligaments, will I be able to get back on the field?
Yes.
Wow.
I mean, right away.
So he doesn't have to even have the surgery?
No, you don't. You never need operated for a
ligaments
shoulder.
Of the labrum.
No, it's only ligaments. Labrum is where the ligaments attach to the bone. That's all. And they throw that out like it's important. It isn't.
That's amazing. I mean, that's why I say,
Now, here's a big thing that's going on with the PTs, physical therapists, the chiropractors, the MRIs, and the orthopedic surgeon. That the whole thing is the orthopedic surgeon will want to operate, but he'll need proof. So you get an MRI. The MRI is read as torn this, torn that. So they say, well, we have to repair all that. You don't. You don't tear anything. You sprain.
So two-dimensional.
It's you pulling out of the bone on the ligament because it's a bone-to-bone connector. Okay, so but you don't tear anything. How can you? I mean, that's ridiculous. I mean,
so let me get this right. This guy's gonna end his year playing.
Yeah, which is sad.
They're gonna operate on him.
Well, if he comes to me, he will not be operated. It's 1 or 2 days treatment. That's all.
Just fixing the ligaments.
That's it.
And they're telling you it's ligament damage.
Yeah.
The shoulder's intact.
But see, it's not strength, though, is it?
No.
No, it's ligaments, which is range of motion. The strength comes with a normal range of motion. You have a normal range of motion. Now you can exercise and make it stronger and faster. But when you get operated like this, you get a scar tissue, which is worse. It's worse than the original injury.
That's even
amazing.
Worse.
Well, you know that from the baseball.
Yeah.
How many people
Psoas scar tissue every time.
How many were operated then came back?
Only, I think we said, what, 24%?
That's not enough. 85% is normal medical improvement. If you get 85% improvement or cure, then the procedure is okay. Not less.
Well, it's funny what you say. For some reason, the people that make that armor stuff, they never said this before until a couple weeks ago, or maybe a couple months ago. 1 out of every 3 people have shown that there was a problem with the Tommy armor, whatever.
Tommy John.
The Tommy Copper.
So for 3 people, 1 has problems. They never said that before. So I guess why do people listen to your show?
I don't know about that, but the whole thing is a baloney thing. It's just a marketing.
Well, Tommy John surgery, almost 35%, which they never talk about, were worse and couldn't play ball again.
I actually treat elbows.
I know that.
It's normal.
I know that.
And there is no surgery for that. Mm-hmm. That surgery should not be done. I don't know where these guys get their ethics. I mean, it's just terrible to do that.
Well, I brought 4 people in that complained about their elbow, and they were cured in 1 day.
Yeah.
And they never. The only time I get a call from them is, "Hey, Wes, this guy is good. He should advertise everywhere." I said, "We're trying." He said, "This guy's amazing." He said, "I couldn't tie my tie," and that was a big guy. He was Freddy's, your size, but big. And he said he came in. What happened was I took him out to lunch one day, and I said, "What's the matter?" He said, I can't move my arm. I said, "Yeah, I know. You look a little disheveled with your tie." So I couldn't tie my tie. So let's go. And it's amazing when you could, to me, when someone's in pain and you could recommend somebody that could take care of that pain. I got a place in heaven for that. So do you, Doc. We'll go to lunch up there. Moses up there will have a nice Jewish dinner.
I'm going to tell you something. Dr. Pannozzo, 2 weeks ago, I had a sore elbow, my left elbow. And I thought I had to go see him to get a shot. It was standing in here at the iHeart Studios. And he presses down.
Yeah, I know.
He pressed down on my shoulder, on my elbow.
He likes to do that.
But I saw stars.
Yeah.
But he said to me, he told me what I had. He says, "You don't need a shot." He says, "Press down. Just keep doing it." And I've been doing this since we did that little escapade. It's gone.
Right.
It's gone.
That was actually a good treatment I gave you, even though you were screaming. Oh, he screams like a banshee.
Oh, I screamed, Doc. It hurt. It hurt a lot.
I don't want you to say your father's a baby boy. When he found what the groin problem is, this little Jewish boy jumped pretty damn high.
Well, he caused a little pain. Well, he needs to see the pain. Well, I wish I was there. I would have had cameras on.
But guess what? It's been over a year. And I didn't have to take off that day. I was back at the gym lifting weights.
Okay. Unbelievable.
Okay, I'm gonna get. We got some more from Washington. Bashad from Washington. I apologize if I'm pronouncing your name wrong. From Washington D.C. asks, "I have severe hamstring issue that doctors have ordered me to bed rest for 3 weeks. How long will I need to rest after you worked on my hamstring?"
No rest.
No rest at all.
One treatment.
And he's back to normal.
And you have no soreness or anything like that?
No, hamstrings are not really hamstrings. They're referred pains. So if you know where it's referred from, you treat it directly, it goes off.
And if it's like the hip or something like that, they're back on the field.
Okay, so what we got another one from Atlanta.
How do people hear from Washington?
You're on the internet.
Huh?
You're on the internet. You're on.
The internet.
You're on the iHeart app.
Oh,
app.
Oh, I see.
And you're on the internet.
So I'll explain that to you in the car, because we have
explain
more.
it to the people listening. They may want to do it.
Well, anyone that has iHeart, anyone that has.
That's Geo.
Well, Geo doesn't know. He knows about iHeart, right? Yeah, iHeart. There's an iHeart app which I have on my phone. They go to the iHeart app and they can listen to your. They can listen to your show.
No
You
kidding.
have TuneIn, which is another.
Yeah, and you have TuneIn where you can listen to your show.
Wow.
Because TuneIn has all these places from all over the country that shows talk shows, and they can listen to your show. So between TuneIn, iHeart, so yes, you get.
Pannozzo.tv, they can see the shows that you do.
So you're getting calls from all these places. You should be very happy. Let's see, we got places from Atlanta. Here's California. That's California one. Jason from California wants to know, how long does it take to cure migraine headaches? I was watching your show online and noticed that though you help those with migraines, is this a permanent fix? Why do migraines happen? Okay, so let's do, first of all, is it a permanent fix?
Yes,
Okay, so they'll never get a migraine again. We know that.
never.
Okay, and the other part that he wanted to know is, why does a migraine happen?
Well, it's a joint pain injury.
Okay. And that could be, we know that could be cured. Okay, let's see. I've outlined some.
So if you have a migraine, you had an injury.
Yes,
So you can't get a migraine without having any injury.
right, correct.
So people that say I eat soy sauce, I eat
Too much
foods
sun.
with too much sun. With
No, the people have been making money on migraines for years.
Wow.
Giving advice like that, writing articles. I mean, I would read these articles in these magazines.
It's in books.
Yeah.
I mean, are you kidding me? These people are stupid. Don't read that stuff.
If you eat liver, liver gives migraines. Caffeine gives migraines. Candy.
None of that is true. Candy, what else? Chocolate.
Yeah. So,
MSG.
yeah, MSG, right. That was the big one. MSG, I remember they said, don't, said to my nephew, don't eat any.
A bad marriage.
Well, bad marriage can give you migraines, yes. Oh, how about two bad marriages? That could even be worse.
That'd be worse. That's a double migraine.
Especially if your wife knocks you around.
Yeah.
You can get migraines.
So you had to have an injury in that region.
That's right.
And a lot of people will tell you, no, doc. And then
Well, a lot of the concussions now, from the NFL and high schoolers and all that,
those are migraines.
Those are migraines. Those are neck injuries, not brain injuries.
Wow.
You can't prove a brain injury. I just read an article. I think
They have all sorts of scanners that show the brain.
but the scans do not show any injury.
They show irregular blood flow.
But that's not an injury. I don't know what
that means.
What does that mean? It doesn't mean anything.
I used to get more
Abnormal.
blood here.
Abnormal for who? Abnormal for who?
I used to get more blood here, doc. And the second time they did it, I don't get no blood there. I can't remember my name.
We noticed.
Yeah, we know. So, it's funny. I was with people, and the girl said, we ordered chocolate cake. And I said, don't you want to try it? She says, no, I got migraines. I said, no, you don't. But I could explain where it came from to just now. But, oh, yeah, my doctor said, so why are doctors giving wrong information?
Because that's all they have.
They don't want to look stupid. They got to give you an answer.
Well, a lot of the health magazines will write about that, and first thing I do when I see something like that, migraine in a health magazine, I look at the author of it. Who wrote this thing?
Okay, today's good. We're getting a lot of questions today. Another one from Atlanta. Nancy from Atlanta writes, I listened to all the shows you play on 860 AM and have come to the conclusion that I want to take my 14-year-old son to see you. He has scoliosis and has been told that rods would help him and that could get him, and he could get them removed in years ahead.
Nobody will remove those.
Really?
No.
She said, this doesn't make sense to me, and I have asked him to watch the show with me, but his fear that you can't help him makes him wonder, what will he do the rest of his life? Will this become a psychological as well as a physical problem?
If he gets those rods, and it will be, do not do the rods. Here's the theory of the rods, why they do it. Ask an orthopedic surgeon, why do you want to do rods? They'll tell you to prevent more curvature. Okay. Well, that's no solution. No. You want to cure the curvature, not prevent more curvature.
Right.
That means you're accepting some curvature. Don't accept anything like that. Do not do rods. You don't need them. That's obsolete stuff. I want this kid to come in. He can come in free. I don't care. You bring him in.
Nancy,
I'll fix this.
You heard what the doctor said. You bring your son down here. It's not that far away. Yeah. You can call him at 561-381-5800.
I want to touch real quick on the subject. I saw the shoe show. Shoe show.
Say it three times fast.
Shoe show. And it's something that we talked about before. And they talk about how they take I guess an implant of your foot, and they explain everything there is to do with your foot, but they don't cure the problem.
They can't cure the problem, no.
They sort of keep it at bay.
Yeah, they just keep you where you are. The theory is we'll prevent you from getting worse. You don't. You don't want to prevent from getting worse.
No.
That's wrong thinking.
You want to get better.
You want to figure out how you cure it. That's the proper thinking, and that's what I do for you.
And therein lies the difference between what you do and other people do, because other people, as long as they can stop it.
Well, if you don't know how to do it, I mean,
how do you fix it?
Why are you telling people you can? It's unethical. I never do that. If I can help you, I will tell you that. If I can't, I will tell you that.
561.
My reputation is better if I tell you I can't do it than if I lie to you.
Yeah.
That's right.
You think I can do
But
it.
that's what
not
happens
true.
in today's day.
No.
Everybody says,
Don't wanna
take
do
this. It doesn't cure you.
I have the old doctor ethics. You know that?
Dr. Wellaby.
Welby.
Welby, I'm sorry.
Wellaby was somebody else.
I got time for one more question. I'm going to read it fast, Doc.
Read it.
Larry from Boca writes, I've been told that I have a bulging disc in my lower back and I need surgery to remove this swollen area. I've watched your show that explains so many things about bulging discs, but I'd like to know, why do they continue to take the MRI to show the area and use it to explain what not's going on? Okay.
Well, it's to sell you on the surgery. That's why. The MRI is read for the surgeon
Right.
to give the surgeon a reason for operating.
Okay.
If you take that advice, you lose.
And an MRI
It's
isn't
also
really...
for the insurance companies too.
Right.
They'll read it that way. But I'm always asking myself, well, if you're bulging on the right, which they never say,
Right.
they never say which side. You know?
Right.
If you're bulging on the right, that means you have a scar tissue on the left. That's why.
Pushing it to the right.
That's
Oh, right.
So,
That's a good idea.
see, that's the way you have to think about this cause and effect. We talk about cause and effect all the time.
Yeah, well, people don't understand what we're talking about. So I see by that lovely lady holding up the 1-minute sign, we're going to say goodbye. And if you want to speak to Dr. Pannozzo, you can call him after the show at 561-381-5800 or go to pannozzo.tv. That's PANNOZZO.TV. And we'll see you next week. And again, happy and healthy Thanksgiving.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.